Hey guys, 20 million Americans have thyroid disease. Almost half of them have thyroid eye disease. If you'd like to learn more about it, stick around. Alright guys, I'm Joel Hayden. Welcome to the EyeCare and Wellness channel, where we talk about all things optometry, wellness, and how to take care of your eyes and yourself for the rest of your life. And if that interests you, consider subscribing or hitting that like button. Talking about the thyroid eye disease, the acronym you may see somewhere is called TED, obviously enough. All right, so of all the symptoms of thyroid eye disease, they are redness, dryness, and watery eyes. And they all go together with dry eye disease, which is the #1 symptom for thyroid eye disease. So at the end, I'm going to talk about how to treat the dry eye with thyroid when you have thyroid eye disease. So with the moderate thyroid eye disease, you get the bags under the eyes, the swelling around the eyes, and you've probably seen that upper eyelid area swells up more. And then, of course, you can get some light sensitivity as well. And I would classify those as moderate symptoms. And if you're having moderate symptoms, and if you're having mild symptoms, you really should be seeing an eye doctor. But definitely if you're having moderate symptoms, and then by the time we get to the severe symptoms, you're going to know that you definitely should be seeing an eye doctor. The severe symptoms for thyroid eye disease include bulging of the eyes, which almost gives away it's a thyroid issue. What happens is the extraocular muscles that wrap around the eyeball swell and push the eye forward. So you can have the bulging look of the eyes, you can have double vision, and then you can have pain around the eyes, especially upon moving them around. So those are the symptoms of thyroid eye disease. Now let's talk about what you can do if you're one of the millions of people who are experiencing the dry eyes from thyroid eye disease. So when it comes to treating dry eyes, it's very similar across the board, no matter what the underlying issue is. But with thyroid eye disease, the first treatment that I would tell you, is what I would tell any of my patients with dry eyes, is making sure that you put in non-preserved artificial tears, especially before you go to bed. So what I would tell my patients is, I would make sure that you're taking some non-preserved artificial tears, a drop in each eye before you go to bed and as soon as you get up in the morning. And for the vast majority of people, that's going to make a big difference, and that may be all you need to do. Then, many times, it's not the aqueous, which is the water that's on the tear film, that's the problem, but it also can be that the oil glands aren't producing the oil layer on the tear film like we need, and they evaporate too quick. So warm compresses usually will work really well at opening up those glands. They're right along the very base of our eyelashes, and getting the oil to flow better out on the tear film, keeping it from evaporating, and keeping your eye hydrated better. One of the things I really like is called a Bruder mask, B-R-U-D-E-R. And I'm going to put a link to the Bruder mask on Amazon down below so you can take a look at it. And I'm also going to put the artificial tears that I want. And then the third thing that I would do is I would make sure you're taking a good fish oil supplement. We're after the omega-3 fish oils. I tell my patients I like them to take 2,000 milligrams a day of omega-3 fish oil, of which 50% is the EPA and the DHA. And finding a good fish oil is tough. I tell people to take vitamin D3, and almost across the board, vitamin D3 is pretty similar when you go from one company to the next. But that's not how it is with fish oil. With fish oil, you really can find some crummy products out there. And so rather than go through the million different things that I need to go through to tell you which one's the best, I'm just going to put a link to it down below. I think you'll find that they don't bother you when you ingest them, and many people talk about the fish burps, but take them right before you eat and that will help keep them down. So there it is, how to treat at least the mild symptoms of thyroid eye disease. I hope this helped. I hope that if you have anything that's bothering you more than that, any of those moderate to severe symptoms, you are absolutely seeing your eye doctor, and talk to your primary about maybe seeing an endocrinologist as well. I hope this helped. If it did, consider subscribing, hit that like button, and until next time, take care.